U.S. President Joe Biden just last month gave Canada's vaccine rollout a huge shot in the arm when he shared 1.5 million doses of AstraZeneca vaccine with this country. Now, Biden promising to give 20 million doses to countries around the world.
We know America will never be fully safe until the pandemic that's raging globally is under control. No oceans wide enough, no walls high enough to keep us safe. Rampant disease and death in other countries can destabilize them, those countries, and pose a risk to us as well.
20 million doses going to COVAX, the international vaccine sharing program, and the supply will come from U.S. production of Pfizer, Moderna, and Johnson & Johnson doses. The first shipments are expected to go out in late June. The U.S. has already promised to send COVAX 60 million doses of AstraZeneca. But you're about to meet someone who says that is not nearly enough. Dr. Gavin Yamey is with me this morning. He is the director of the Center for Policy Impact and Global Health at Duke University. He's in Durham, North Carolina. Professor Yamey, it's a pleasure to have you on our program this morning.
Thanks, Heather, for the invitation. Delighted to be with you.
We can bring up a tweet that you wrote just recently because it gives us your response to the president's announcement. I'd like to explore that a little bit first with you. 20 million doses. I guess what's important is Pfizer, Moderna, J&J. These are vaccines the United States uses. AstraZeneca not approved for use in the United States, so that 60 million is a bit moot. But what do you think of this latest 20 million dose promise?
Look, it's a very welcome move, obviously. It is better than nothing. It is very small in terms of the size of the crisis, right? 20 million doses, let's just say if they were all to go to India, that would vaccinate 1.4% of the Indian population. So it is not enough. We need to do way more. The US and other nations are sitting on many excess doses. The best estimates are that there are somewhere between 200 and 300 million doses ready to go now that are not being used. Those could be shots in arms now. In addition, Seth Berkley, the CEO of Gavi, the Vaccine Alliance, estimates that rich nations have procured 1.5 billion doses that they won't need. This is through these advanced purchase agreements from vaccine manufacturers. Many countries, Canada, the US, the UK, they procured enough doses to vaccinate their populations many times over. They must release those doses and donate them to COVAX. And the last thing I'll say, maybe we can get into this, is we need to support low and middle income countries to be able to make their own doses. Charity, we need charity now, give doses to COVAX, but beyond charity, we need a sustainable model where countries can make their own vaccine doses.
Okay, there's a lot there to explore in some more detail, but it's interesting. I mean, you've been active all along in this pandemic, arguing against the hoarding of vaccine by the wealthy nations of the world, and as you say, they've secured almost 90% of the available vaccine supply, and as a result, I guess we're seeing a tremendous disparity in terms of how countries are dealing with COVID. So you argue that it's in the best interest of the wealthy countries to share the vaccine supply in a more equitable fashion. Why is it in wealthy countries' own interest?
Well, let me first say that the reason we should be sharing doses is for reasons of justice, fairness, equity. And it's just impossible to look at what's happening in India and not act. We should act because people are dying from a preventable illness. This is a vaccine preventable illness. So that's first and foremost. But you are right. It is also in rich nations' interests, kind of self-enlightenment, if you like, to act. And that's for a couple of reasons. Firstly, there is a mantra in global public health that an outbreak anywhere can become an outbreak everywhere. You cannot hermetically seal your nation off from the rest of the world. Secondly, we know that when viral transmission is out of control, in places like Brazil, this happened, the UK, South Africa, that increases the chances of new variants of concern, which again will not remain in those countries. And the third reason is that it makes economic sense for rich nations to support low and middle income nations in ending the pandemic. One study estimated that if rich nations are more or less fully vaccinated by the end of the summer and low and middle income countries are left behind, there will be a $9 trillion economic loss globally. And half, get that, half of that loss would be borne by rich nations themselves because of things like reduced exports and disruption to supply chains. So it is in rich nations' enlightened self-interest to also tackle global pandemic.
And as something that you have advocated, as you mentioned, as an immediate response, is almost a tithing system. How do you see that working?
Yeah, so I wrote a piece in Nature a while back in which I argued that in an ideal world, what rich nations would have done was, as they were vaccinating their own populations, they would also give doses, donate doses to COVAX, the global sharing solidarity mechanism. And, you know, some nations chose to do that. Norway is doing that, for example. We know that New Zealand has given enough doses to COVAX to vaccinate 800,000 people in low and middle income nations. We know it can be done. And I was suggesting a tithe. You know, it's a sort of Judeo-Christian idea of giving away 10% of what you own. I was suggesting it really wouldn't have been a big lift for rich nations. After every 9 doses that they, use to vaccinate their own populations, they give 1 to COVAX. Unfortunately, what happened, as you know, is that rich nations have hoarded doses. They have cleared the shelves and they have left COVAX and low and middle income nations really at the back of the queue. And that absolutely has to end. So that's the immediate need, is for doses right now to go to COVAX. And then in the longer term, we also, as I said, need to support low and middle income countries to make their own doses. So if we take Canada, for example, Canada should be donating doses, including AstraZeneca doses that is not going to be using. And I believe that there are millions more doses coming to Canada that it won't use. And I think Canada should support the intellectual property waiver, as the Biden administration does, so that countries are enabled to make their own doses. The waiver won't be enough on its own, but together with sharing the know-how, tech transfer, and supporting globalized manufacturing, we can have countries making their own doses by the end of the year or early into 2022.
So I was going to ask you about Canada. You've raised it specifically. I mean, Canada would argue the latest number is from May the 3rd, going back to this month. The financial contribution from Canada to COVAX so far is $325 million. But you'd like to see more from this country?
To be honest, money right now is not actually the barrier, right? If you've got millions of dollars in donations to COVAX, or billions, that's great. Of course, we need to fund COVAX. But those dollars can't buy doses right now that don't exist. So it would be far more pressing and urgent for Canada, the US, and other rich nations to donate doses that are ready to go into arms now. Of course, funding COVAX is important. As supply ramps up, COVAX will then have the funding to buy doses. But it is this shortage of supply right now that is the more urgent, more pressing issue. Donating doses ready to go matters more right now than donating funding.
That the saying in health, and we got that in a tweet just yesterday, a reiteration of that from Dr. Tedros, the president of the World Health Organization, no one is safe until we're all safe. And yet there is still a strong argument within some of those wealthy countries that the need is to protect their own citizens first. Do you still have to counter that response?
Look, I understand, I completely understand and I have benefited from being vaccinated myself. My family in the UK have benefited. I can, sleep safer at night knowing that my parents are protected. My sister, a physical therapist who works with COVID-19 patients, is protected. I'm not naive enough to think, countries don't need to look after their citizens. They do. All along, the vision of COVAX was that we should protect health workers and the most vulnerable first. That was the idea. So that in every nation, about 20% of the population, health workers and high-risk people, would be vaccinated first. That would have been fair, equitable, and good for global public health. That's not what happened. In fact, rich nations blew past the 20% in this sort of quest for themselves to reach vaccine herd immunity. And that's where I think things could have been different. Dr. Tedros said to rich nations, look, once you have protected your health workers and the most vulnerable, pause and start donating to COVAX. At the same time as you expand vaccination to the general population, we know you're going to do it, but donate doses to COVAX at the same time so that we can get the highest risk people protected, simultaneously. And that it's tragic that never happened. So now you have a situation that's been called vaccine euphoria, where people in rich nations are feeling great about the upcoming summer, they're planning holidays. They sort of think the pandemic is ending or almost over. And in many ways, of course, it is in rich nations with plentiful doses. Meanwhile, much of the rest of the world is on fire. Brazil, India, Turkey, Nepal, so many hotspots. It isn't over. Absolutely not.
You mentioned your family ties in the UK, and it's interesting for our viewers, and I think we have a tweet that shows exactly what you were doing just before our conversation. You were briefing the British Parliament as part of regular committee hearings, I understand, but I'm also wondering, as you speak to the UK, it's the UK going to be hosting next month the G7 summit. And I'm wondering if there was any discussion, or whether you would like there to be discussion there, greater pressure brought to bear of the leaders of those wealthiest nations on this exact point, what you would be hoping to come out of the G7.
Absolutely. I mean, absolutely. A firm, clear, bold commitment from the G7 to donate doses, to fund COVAX, and to support lower middle income country nations themselves in making doses. One of my concerns right now is that it doesn't really seem that we have a overarching global multilateral strategy to end this pandemic. It seems very piecemeal. There's the 20 million doses that Biden is going to give by the end of June. There's the IP waiver that may be happening. There's a little bit of this and a little bit of that. What we don't have is an overarching strategy that is about the sharing of doses now in an equitable way, together with ramping up manufacturing that has to happen in lower middle income countries as well. Charity is one thing, the sort of crumbs from a rich person's table model. We need that, absolutely. We need doses to be shared by the rich world. But beyond charity, we need a sustainable model, and that is a three-legged stool. It is the intellectual property waiver, tech transfer, and it is about supporting manufacturing in lower middle income countries. And we need all three. The IP waiver is like a recipe. Tech transfer is like having a master chef in the kitchen to explain the recipe. And then the manufacturing is what's going to really ramp up supply. We need all of those. And I really hope the G7 not only pushes for the charity model, but also for this long-term sustainable model. We have got to end what Canadian Professor Madhuka Pai calls the trickle-down manufacturing approach, where vaccines get manufactured in the global north and then we just sort of hope a few doses trickle down. No, those days are over. Manufacturing has to happen in lower middle income countries themselves so that they have the power and the control over mass vaccination by the end of the year.
Dr. Yamey, save some time for us next month when the G7 is meeting, because I dare say we'll want to continue this conversation. I very much appreciate your expertise this morning. Thank you.
Thank you. I really look forward to coming back next month.
All right. Thank you.